Do you know the 10 symptoms of colon cancer? Recognizing these signs early can make a significant difference in your health journey. Today, we're going to delve into each of these symptoms, giving you the knowledge you need to stay proactive about your health. Leading our discussion is the topic of changes in bowel habits. Healthy bowel habits typically consist of one movement per day, but everyone's normal can vary slightly. There are those who may go or thrice a day or even every other day, and all these are considered normal as long as it's consistent for the individual. When it comes to colon cancer, persistent deviations from your regular bowel such as unexplained diarrhea or constipation can be an alarming sign. For instance, you may notice a significant shift in your regular bowel movements that persists for more than a couple of weeks. This could be sudden bouts of diarrhea that last for days, or an enduring struggle with constipation that doesn't improve with increased fiber intake or hydration. It's essential to understand that it's not just about the frequency, but also changes in the form or appearance of stools can indicate a problem. Blood in the stool or unusually narrow stools are worrisome signs. If the change in bowel habit is persistent and unexplained, it should never be dismissed as a fluke or irregularity. This could be an early warning sign of colon cancer. Secondly, the presence of blood in the stool is another significant symptom to be aware of. This can manifest itself as bright red blood or as a dark-colored stool, a result of blood being digested. Noticing this can be alarming, and understandably so, but it's paramount to be vigilant about these changes. The reason for this occurrence is often due to the cancerous cells in the colon causing bleeding, which then mixes with the stool. Even though this doesn't sound pleasant, it's a critical sign of potential colon cancer. Accompanying symptoms may include discomfort in the abdomen, sudden weight loss, or persistent fatigue. It's essential to pay attention to these as well, in case they are present alongside the appearance of blood in the stool. The sooner these symptoms are identified and addressed, the better the chances for early detection and successful treatment. Moving forward, let's talk about abdominal discomfort, which is a notable symptom of colon cancer. This discomfort can manifest itself in various ways, such as a consistent pain, random cramps in your stomach area, or an inexplicable feeling of bloating. Unlike normal stomach aches that come and go, this tends to be persistent and might get worse over time. The cause behind this could be the growth of a tumor in the colon, which puts pressure on the surrounding area, leading to constant discomfort. If you find yourself frequently uncomfortable after meals or even when your stomach is empty, this could be more than just routine indigestive issues. Such discomfort is definitely worth mentioning to your doctor, as early detection is key in treating colon cancer. Unexplained weight loss, particularly significant weight loss, is our fourth symptom to be noted. If you're shedding pounds without making any conscious effort to, and it's not due to alterations in your dietary habits or physical activity, it may indicate a more serious underlying issue like colon cancer. When we say significant, we're referring to losing more than 10% of your body weight in a span of 6 months, without any apparent reason. That could mean, if you were 150 pounds, a weight loss of 15 pounds or more could be concerning. This unexplained weight loss could be coupled with other symptoms like persistent abdominal discomfort, changes in bowel habits, and bloody stool. These combined symptoms could be your body's way of flagging that something isn't quite right. It's always recommended to consult with your doctor if you notice such symptoms. The fifth symptom presents as persistent fatigue. Now, it's normal to feel tired after a long day or after strenuous activity, but the fatigue associated with colon cancer is markedly different. This isn't the typical tiredness that we all experience from time to time. It's an overwhelming, persistent exhaustion that doesn't improve with rest and can interfere with daily activities. This fatigue stems from cancer cells using the body's energy and nutrients to grow and multiply, leaving less for the normal cells. Furthermore, the body's immune system, as it fights the cancer, also uses a significant amount of energy, which can lead to this constant state of tiredness. If you're feeling continuously drained and rest doesn't seem to help, it could be signaling a more serious issue like colon cancer. Coming up next on our comprehensive list of symptoms, we delve into the uncomfortable reality of incomplete emptying of the bowels. This happens when you get the unshakable feeling that you need to relieve yourself, even after you've just done so. This unsettling symptom of colon cancer occurs due to the tumor obstructing the passageway, preventing the full evacuation of feces. Regrettably, this isn't a standalone symptom. It often comes hand in hand with a host of other distressing signs. You might experience a consistent change in your bowel habits, including diarrhea or constipation. Blood may appear in your stool, a glaring red flag that should never be ignored. Furthermore, Persistent abdominal discomfort such as cramps, gas, or pain are often present. So, if you notice any of these symptoms persistently manifesting along with the feeling of incomplete bowel emptying, it might be time to schedule an appointment with your healthcare provider. The seventh symptom to pay attention to is iron deficiency anemia, a common and often overlooked symptom of colon cancer. This form of anemia occurs when your body lacks enough iron to produce the necessary number of red blood cells. This deficiency can leave you feeling persistently tired and weak. With colon cancer, this anemia can occur due to the slow, chronic loss of blood from the colon, which is often not noticeable to the naked eye. Over time, this steady loss of blood can lead to an iron deficiency, as iron is a key component in the production of new red blood cells. If you're experiencing iron deficiency anemia, you might also notice other symptoms such as pale skin or shortness of breath, both signals of your body's struggle to deliver enough oxygen to its tissues. Additionally, symptoms can include unusual cravings for non-nutritive substances like ice or dirt, a condition known as pica, restless leg syndrome, a strong urge to move your legs because of uncomfortable sensations, may also be a sign. Understanding these symptoms is crucial, as they could point towards colon cancer. So, stay vigilant and listen to your body. The eighth symptom on our list is narrow stools. This isn't about an occasional deviation, but rather a noticeable change where your stools have become thinner over time. This symptom occurs due to a blockage in the colon, typically caused by a polyp or potentially a cancerous tumor, which leads to altered bowel movements. The change in stool shape happens as the body tries to navigate around the blockage. Alongside this, you might also experience other symptoms such as unexplained weight loss, consistent fatigue, or even blood in the stool. Any persistent change in your bowel habits should be a cue for you to consult your healthcare provider. It's always better to be safe and proactive when it comes to potential signs of colon cancer. Persistent gas or cramps is the ninth symptom, and it's crucial to pay attention to it. When we talk about persistent gas, we're referring to frequent bouts of bloating or passing gas that seem abnormal or excessive. This happens because colon cancer can cause a blockage in the colon, which leads to these digestive problems. Similarly, cramps that are continuous and severe could be another sign. These cramps occur due to the tumor interfering with the normal functioning of the colon. Alongside persistent gas and cramps, other related symptoms might surface. These could include a change in bowel habits like diarrhea or constipation, and blood in the stool. The latter is due to the tumor bleeding into the digestive tract. When these symptoms accompany persistent gas and cramps, it could indicate a more serious possibility of colon cancer. At last, we come to the final symptom on our list of signs to watch for: unexplained weakness or fatigue. This isn't the type of fatigue that comes from a late-night binge-watching session or a particularly intense workout. This is a profound, ongoing weariness or weakness that seems to permeate every aspect of your life, a tiredness that sleep doesn't seem to alleviate. It's a common symptom of colon cancer because as the disease progresses, your body's resources are increasingly consumed by the growing tumor. This constant struggle can result in a draining sense of fatigue. Cancer can also cause anemia due to blood loss, which can occur with tumors, further exacerbating feelings of weakness and exhaustion. If you're experiencing this level of fatigue and it's not correlated to overexertion or lack of sleep, it's an important signal that shouldn't be ignored and definitely worth getting checked out. So there you have it, the 10 symptoms of colon cancer: changes in bowel habits, blood in the stool, abdominal discomfort, unexplained weight loss, fatigue, incomplete emptying of the bowels, iron deficiency anemia, narrow stools, persistent gas or cramps, and unexplained weakness or fatigue. These symptoms might seem common or even benign on their own, but when they persist, they could be indicating something far more serious. Early detection is crucial in the fight against colon cancer. It's important to listen to your body and seek medical advice if you notice any of these symptoms persisting. Stay informed, stay vigilant, and always prioritize your health.